16, and we would like to ask you certain questions on the areas of health and healthcare management. So, sir, firstly, please tell us about your personal journey in health and in healthcare.
I'll tell you about right from my early childhood. I was born and brought up in a small town, and going to school and education used to be fun those days. You know, there was no pressure of going to these competitive classes, and not much of stress. We used to walk to school, have fun on the way, and coming back home also there was not pressure from parents. So class में first कौन आया, आपको भी first आना है, number क्यों कम आया. So that's where I spent my childhood. And right from my early childhood, I don't know whether it was my parents or somebody who put it in my mind, and I always wanted to be a doctor. So when anybody asked who is sure to become a doctor, I was the first one to get up. Even in class 11 and class 12, after class 12 you get into medical school. So fortunate that I got into All India Institute of Medical Sciences, and that institution opened up my mind. You know, you question everything. Why this is happening? You ask your teacher, sir, I don't agree with you, what is your diagnosis? And then the teacher will explain to you. So that orientation early in my career in medical school gave me very good perspective of questioning everything and doing better in whatever you are doing. And like any medical doctor, I wanted to be a clinician, preferably a pediatrician, or maybe second option was to become a medicine specialist. But then I was very keen on army, so I went to army as a fresh graduate. In army, I saw how public health, preventive measures improve health. To give you one example, in army they have not had even one case of tetanus since Second World War, since First World War, not just Second World War. So that convinced me that there are preventive methods available which can improve health substantially, bringing down both deaths and sickness in the population. So then I came back from army after 5 years, because the army, they don't like you questioning everything. Very regimental, you have to do what you are told to. And my bringing up in aims was question everything. Why this is happening, why that. In army they don't like it. So I left after 5 years and then came to do my public health. From All India Institute of Medical Sciences, I did my MD in community medicine, went into teaching, and I feel I'm basically a restless person. After 2 years of teaching, I thought it's not exciting enough for a public health person. So then I did a consultancy for UNICEF, and when I was coming back to my teaching job after completing consultancy, they asked me if I was willing to join UNICEF as a regular staff member. So I applied and landed in UNICEF for more than 20 years, and it took me around the world to work in 28 countries outside India. But academics and training remained my love. I never missed an opportunity of going to an academic institution, taking sessions. So then, having spent 22 years and 12 years outside India, both me and my wife thought of coming back to India because we were feeling homesick. So came back to India, but in India the time I landed was very exciting. A lot of things are happening in health. Government is giving a lot of importance. National Health Mission had started. They started looking at urban health, and National Urban Health Mission has started. So a lot of activities in India. Public health is getting more important than it used to get when I left India. So came back to academic, joined IIHMR, then went away for some time to head the National Health Resource Center of Ministry of Health, Government of India. Came to know what is happening in health in the country and in the states. And then back to IIHMR, now as director. The one thing I want to emphasize is the family support was very, very helpful to me. When I wanted to take a chance from a regular job to a contractual job, I asked my wife, I want to join UNICEF, but they don't have job security. So they said, no, go, I'll manage the house. I'm earning, she is also a doctor. So I could take chances because of the support. Then my daughters, both of them have been very supportive. Whenever I went on international assignment, they never pulled me down. They had to manage on their own. and now both of them are growing up in their respective field of profession. So that was very important in my personal journey, and support from my parents. So that's one thing which I can think of, other than professional journey, the family support.
Sir, and what are your thoughts on the current health status in India?
Health situation in India, I would say, is at crossroads now. We have done a lot in improving maternal child health and bringing down communicable diseases. If you look at the health indicators, for example, under 5 mortality rate has come down from 126 in 1990 to 48 in 2015, which was the end point for Millennium Development Goal. Similarly, maternal mortality ratio was estimated to be 560 in 1999. Imagine, so many mothers were dying. Out of 100,000 lives, was 560 mothers lost their life, bringing a life into the world. And now it is down to 174, so almost 1/4 of what it used to be. Substantial improvement. And similarly, infant mortality rate. Recently, data has come out. We have had substantial reduction in infant mortality rate. It's come down to 34 now. So substantial improvement. Similarly, on communicable diseases, we have eradicated smallpox. India was the last country, but we are not the last country when it comes to polio. We have eradicated polio ahead of 3 other countries. We about 7 years back, we accounted for more than 2/3 of polio cases, but in 2013 we were declared polio free, and we continue to be polio free. Maternal neonatal tetanus, we have eliminated that as well. Yaws, we have eliminated. Guinea worm, we have eliminated. So a lot of progress in communicable diseases. But when you compare with other countries in the neighborhood who are poorer than India, and other countries outside the neighborhood who have similar level of economic growth and development, their indicators are much better than us. We need to do something more than what we are doing, strengthen the health system, have health care available to everybody who needs it in the society, and also have safe water available, sanitation available. So recent initiatives by government are going to help us in improving health outcomes through investments within health and certainly outside health system like Swachh Bharat Abhiyan and so on. So that is going to help us a lot. We are, I feel, at a stage when every one of us working in public health feels excited. We are at a threshold of making history in improving health in a substantial manner in the country.
And sir, NCDs are on a rise these days, the non-communicable diseases. And what is the status of NCDs in India particularly, and what can we do to mitigate the status?
A very appropriate question. Non-communicable diseases are not, I would say, not are, but have already emerged as a major public health problem in the country. And this also gives us an opportunity to look at how does health system work, because for addressing NCDs, you cannot continue to work the way you used to work for maternal child health and communicable diseases. You need to look at the whole population. Today, for example, 60% of deaths in India, out of about 1 crore people who die every year in India, about 60 lakh, 6 million die of non-communicable diseases. Cardiovascular diseases are number 1, which include hypertension as well, about 2.7 million or 27 lakh die of that. Then you have cancer, around 1.2 million because of cancer. Then you have diabetes, and India is already known as the diabetes capital of the world. So we will become cancer capital of the world, we will become cardiovascular diseases of the world. The trend at which these diseases are increasing, we are heading in that direction. And to this you add around 1.2 million deaths which take place because of accidents and injuries on the road, at home, and in public places. So all this put together 72 lakh, which is almost 2.5 times the deaths caused by maternal child health conditions, nutrition, all communicable diseases, nutrition problem put together. So it's a huge problem, and we need to address this in a comprehensive manner. And what we need to change in healthcare delivery is look at the whole of population approach. And they have a saying in public health that you are detecting new cases of NCDs, cancer, diabetes and cardiovascular diseases, but the tap is on. The diseases are coming out and you are mopping the floor to keep it dry. You have to close that tap, and that can be done only when you have strong prevention and health promotion measures. Those people who are healthy, don't have any of these conditions, how do you keep them healthy? So whole of population approach and the concept developed by Dr. Pita and me on 4 groups in population, you can cover everybody. One is those who are healthy, how do you keep them healthy? Those with risk factors, how do you keep them healthy? You need to do more for those with risk factors because they are more at risk of getting disease. Then you have those who are not known to have disease, but they have the disease. So screen them, detect them, put them on treatment. And then those who have the disease, even there we don't have compliance. People with diabetes don't take medicines regularly. They don't have the lifestyle we want them to have. So this is the whole of population approach we call it. We need to adopt for NCDs, unlike communicable diseases and maternal child health conditions.
Sir, how big of an impact does poverty, education, and population make on health?
Excuse me. You have a term called social determinants of health. And this is emerging as more and more important area for improving population health. There was a commission set up by World Health Organization globally, and a similar commission was set up in India to look at social determinants of health. So let's start with poverty. Poverty is both a sequelae of poor health, and poverty causes poor health. So this is a vicious circle which is put in place. In India, 32 million, 3 crores, 20 lakh people go below poverty line every year because of medical treatment. They are poor, so they remain poor. Those who are not poor, they become poor. So 3 crores, 20 lakh, one single factor, most important factor accounting for poverty in India. Then those who are poor, they are more likely to have disease because they don't have access to proper food, lifestyles, medical care at an early stage. So it becomes a vicious circle. Those who are malnourished or have ill health are not as productive members of the society as a person with good health is. So perpetuates the cycle of poverty and ill health. You can take examples of education. We have studies across the world, not just in India. An educated mother is more likely to have a healthy baby, less likely to have a child dying young in age, is less likely to die herself. But what we are missing in education is health literacy. People go to schools, colleges, universities, but they are not given health literacy. How do they keep healthy? So we need to work with education departments and ministries to make sure that we develop healthy lifestyle. And this will also close the tap of non-communicable diseases. When they are growing up, they develop healthy lifestyle, they have physical activity, they have healthy dietary practices, they don't smoke, they don't drink alcohol, and then they remain healthy. So those 4 universal precautions we call it for non-communicable diseases can become part of their life. So education is important, but within education, health literacy is also equally. You can look at water and sanitation. I often say 250,000 tons of fecal matter tsunami hits Indians every day. This is the amount of fecal matter deposited in the open because people use open defecation. And this gets washed into water bodies, people get diarrhea and other diseases, and my strong belief is this is the major cause of India having such a high level of malnutrition in the country. So with the recent initiative on Swachh Bharat Abhiyan, hopefully this will get addressed.
So what advice would you like to give to students of public health and healthcare management?
My first message to all the students, not just students, or everyone who is working in public health is that we are at an exciting time in public health, globally, but certainly in India. We have all the pieces available to us, we have to put them in the right place, and I feel we are at a threshold when health indicators are going to improve substantially. To the students specifically, keep the focus on what is changing within health and what is changing outside health sector. Because a lot of changes in healthcare delivery are taking place not because of advancement in health, because of advancement in other sectors. IT is revolutionizing healthcare. So keep an eye on that, and in our 5 values, the value of information and knowledge sharing is very relevant in that matter. The other value we emphasize in IIHMR Delhi is quality. Whatever you do, it should be the best you can produce. Don't accept anything which is below your standard. And I often say, you don't get the service you deserve, you get the service you accept. So never accept anything substandard, even if what you are doing. Then second is trust. Build trust. In health we cannot work by ourselves. We have to work as a team. To build the trust in the team you are part of. Then transparency. Whatever you do, you should be transparent. You are not doing anything for personal gain. You are doing it for improvement in health, and hold yourself accountable. If you are not delivering, you are accountable. Don't wait for others to hold you accountable. You are accountable to yourself. So don't accept anything which is substandard. Your own conscience should be asking you, have you done your best?
Thank you so much, sir, for sharing your thoughts and sharing your journey with us.
Thank you.